Hi everyone. So I'm Stuart. I'm a doctor from England initially, but really pleased to be here now and made this my home. Um, Sorry. This- How's that? There we go. Perfect. So yes, my passion is in preventative healthcare, family medicine. I do a lot of work in unattached settings such as walk-in clinics. I myself do not have a family doctor, and my family does not have family doctors, so I understand the concern. And whilst I am a doctor myself, the college frowns upon us treating ourselves or treating family members. So yeah, I feel that pain. And that's really what brought me and my colleague to create this organization called CanScreen. It was really to try and help facilitate people who either do not have access or have difficulty accessing the system to get preventative medicine. We wanted to do a clinic for all of preventative medicine. We recognized that was quite high, so we started off with cancer, because as we can see, we have very clear screening pathways. We have great evidence-based screening tests, and we have very good ways of managing those results once we get them in. And really what led us down this path was my work in the unattached setting, where I see people often in crises, but we're missing that preventative bit. People, it's either an afterthought to us as clinicians, or people just aren't going to queue for 6 hours to come and see us about getting a fit test requisition or a colonoscopy requisition. And these are the stories we're hearing. I was never able to access primary cancer screening, waited in line in various walk-in clinics for over 6 hours, and ended up leaving before meeting with a healthcare professional. I have no access to any preventive care, no GP, no MP, nothing. Very scary. And so a colleague and I decided to start CanScreen. And in essence, this is what we're trying to do. We want to facilitate evidence-based cancer screening and surveillance services. We offer continuity of care, and I think this is the real key piece, and this is what the unattached or people accessing the system miss, is that continuity of care. And there's been a big push for attachment by our politicians, and it's currently top of all the healthcare agendas. But the reason attachment is so important is that continuity piece. Your family doctor will know your history. They'll know your family history. They know what tests you've already had. They know what risk factors there might be. And if you have a diagnosis, they can help support you down that entire journey. So for patients who screen with us and get a positive result, when I say positive, I mean they get a cancer diagnosis, we're going to support them every step away as far as we can go with those further investigations and subsequent treatment as well. The aim is to be complementary. We're not trying to replace anybody. We're here to complement the family doctors, the nurse practitioners, and the urgent care settings, and hopefully take some of the pressure off places like the emergency department as well. Perhaps a bit of background first, though. One of the reasons this issue currently exists is a bit technical. It's just legislation. Currently, almost every test ordered has to have a provider's name attached to it. The HPV test, which I'll touch on again, is the first test of its kind where actually now you can get that requisition, whether you've got a doctor or not, or a nurse practitioner or not, that you can get straight and request to self. But every other test does have to have a provider on still. And the other part of that is to receive the results. Some of these results are not always black and white, and some of them need further follow-up. So you've got a primary care doctor. How you access these tests is super simple. You do not need our services. You can go and see your family physician. They will be able to discuss your risk. They'll be able to arrange appropriate breast cancer screening and colorectal cancer screening, and potentially lung cancer screening as well. In addition to that, as has already been mentioned, the HPV test, you don't have to see your family doctor for. You can actually just go online, go to the website, order that self-swab kit at home. However, there are some people who will still require a PAP, and obviously that needs to be done in person. The breast cancer screening system is also similar. And although there we have the hot number, similar thing, if you have a family doctor, you can call that number and you can get booked under your number. I'm pleased to say for unattached patients now, we've also got that in place. So if you do not have a family doctor, you can also use that centralized telephone number to book your mammogram. And all you have to do is if you want to book with our clinic, you can say you're going to be booking with CanScreen, and they will book you in at the next available test at your closest screening site. So you don't need to speak to us in advance. You don't need to get a requisition from a walk-in clinic. You can simply tell that to them once you ring this number. So no different to your colleagues, friends and colleagues who might have who are family doctors. Breast, for other screening tests such as fit tests, colonoscopies and lung screening tests, then you'll need to book with us so we can go through your risk history and order that appropriate investigation, that appropriate test as well. And this is what the booking process looks like. So we've basically highlighted each test in turn, hopefully making it as simple as navigate as possible. Website has other information about it. It has information about those people who've got symptoms. It has information on eligibility criteria, and when we really stress again that if you do have symptoms, where you should be seeking some further support from. Depending on which test you're booking, you'll find you'll be prompted to input your demographic information, including your PHN number. This basically builds your profile on our EMR, the electronic medical record system, and it's where your result will get attached to. So when that screening test is done, it all gets put back into the system straight away. The one exception to that is the HPV screening. That obviously, if you realize you're eligible for that, that link directs you straight back to the BC Cancer website where you can order that yourself and you can do that swab for yourself at home. The one extra thing which we haven't talked about today, which we offer, is the cancer surveillance. This is a little bit different to screening. This is geared up to people who've already had a cancer diagnosis. They've been treated, they've been discharged from BC Cancer, but they need ongoing surveillance. Surveillance is another type of screening, but it depends on the type of cancer you had, and you'll have very specific instructions, such as needing a CT scan every 6 months or needing a certain type of blood test every year for so many years after those tests. And we've certainly encountered patients in the community who, once they get discharged from into the community, they don't have a family doctor. Again, they're lost to these services. You're busy trying to queue for walk-in clinics, trying to be to get a telehealth call with TELUS or one of the other companies, and getting that continuity is lost. So for those patients, we also offer that continuity piece, and we can support you during that surveillance journey. Once you've had your appointment and you've completed your kind of screening questionnaire, which you'll be asked to do at that time as well. You'll be speaking to myself, one of my colleagues. We basically go through that risk questionnaire. We review your symptoms. If you have symptoms, we review your family history. We review your personal history, and we'll decide what tests might be necessary. We can divert you down the FIT path or the colonoscopy path. We can arrange lung screening tests. We might also be saying, you know what, things are really high risk. We should actually get referral into the hereditary cancer screening program as well with BC Cancer, one of the other high-risk programs. So this is where the input, it's a telehealth conversation, but this is where that conversation can be happening. If you're not sure if you fall into those categories, again, you can book online and we can have that conversation. So you don't need to go and book that test directly if you feel like you might need more regular screening or a different type of screening test. Once we get the results, we follow up on all results. We don't go by the no news as good news. That really just stems from a way of dotting the I's and crossing the T's. We want to make sure there's never a situation when someone's sitting at home assuming all is well when actually results never been seen. And sadly, the system is not perfect. The computers do not always talk to people. And again, for those patients who have lost their family doctors, we've seen cases where results have gone to your retired doctor and it hasn't got back to where it's meant to go. So we encourage patients to, if you haven't heard from us and it's been more than a couple of weeks since you've had your test, then you're welcome to book that follow-up appointment and we can rediscuss your future screening recommendations and the results as well. Generally speaking, it works well though, and you'll get an automated email once those results come in. FIT tests, we're looking at about 3 to 4 days. Mammograms, about 5 to 10 days. Colonoscopies take a little bit longer. They're more like 3 to 4 weeks, and that's partly because we're looking for different parts of that report to come in. The last piece being the histology, which is when they look at it under the microscope. So we want to have all those pieces together to talk about your next recommendation and guidance after that time. Positive results are handled much in the same way, except we're going to be badgering you. We're going to be chasing you down. We're going to be putting phone calls in as well to make sure those results are appropriately followed up. Usually, we haven't got definitive results. It just means you're getting that next test. You're getting that diagnostic test to further review that pathway, further review that process. So, in essence, we've hopefully made this as easy as possible for you to book and book these screening tests. We know doing it when it's at the forefront of your mind is important. We've got availability usually within 1 to 2 weeks, so it's not big waits to get these tests completed. The one final thing I would stress is that continuity piece. And this really is one of the cornerstones to your care. And even if you don't have a family doctor, even if you have struggled, some of these tests can also be organized by any other healthcare practitioner as well. If you already have a relationship with a walk-in clinic, if you already have a relationship with one of the online doctors like TELUS, then by all means request it through them. Having all your information in one place is really important. It's important for your care, it's important for your team, and should ever there be a positive diagnosis and a cancer diagnosis, that continuity is really, really important. So with that, Short and sweet, and I'll pass this back to Pippa.